learning objectives of this film are 1. To describe how pictographs can increase patient comprehension of medical procedures. 2. To create a pictograph for a common office-based gynecologic procedure. 3. To incorporate pictographs into patient education in the clinical setting using only a pen and paper. Approximately 90 million adults in the United States have poor health literacy. Poor health literacy, such as reading, listening, and numeracy, is associated with poor health outcomes. The majority of information given to patients in the clinical setting is given verbally. However, 40 to 80% of verbal information from physicians is forgotten almost immediately. Research has shown that written information is better remembered by patients. However, a patient's literacy level impacts their ability to understand written information. Roughly 20% of adults, or 1 in 5, read at or below a 5th grade level, which limits our ability to educate a significant number of patients using only printed health-related materials. As such, pictographs have been explored as a tool to improve patient education. Pictographs combine words with illustrations to help facilitate learning and future recall. For example, previous research has shown that only 14% of verbal medical instructions is remembered by patients, compared to 85% of medical instructions provided through pictographs. The benefits of pictographs extend beyond short-term recall, as 71% of instructions given using pictographs are still remembered after 4 weeks. To maximize patient comprehension and long-term understanding, health educational material should be written at or below a 6th grade reading level and should include illustrations and pictures such as these. The purpose of this film is to demonstrate a few simple pictographs or sketches with labels that can be drawn in clinic by medical students to educate patients on office-based gynecologic procedures such as pap smears or endometrial biopsies. Gynecology clinic routinely involves procedures that involve anatomy and information that many patients are unfamiliar with. For example, in a study of 236 college students, 46% of women were unable to identify the cervix on a diagram, and only 52% could correctly answer a multiple choice question on what is a pap smear. These results support our belief that pictographs can be used in gynecology clinic to better educate our patients, especially patients with lower health literacy, on procedures that we routinely recommend. We will now demonstrate 2 examples of pictographs that can be used to educate patients on 2 common office-based gynecologic procedures, pap smears and endometrial biopsies. These pictographs are quick drawings with labels that medical students can sketch in front of a patient. It's important to note that these pictographs are not used to consent a patient, but rather to help inform and educate a patient about procedures that we are recommending to them.
The first pictograph we'll be demonstrating will be a pap smear. So a pap smear is a test used to screen for cervical cancer or abnormal cells that could lead to cancer or infections. So your cervix is the lower part of your uterus, which is the medical term for your womb, and it's located at the back of your vagina. So to draw out, we'll be looking at a side angle of the uterus and the vagina, and this is your uterus. And here is a small opening known as the cervix. And here is the vagina. So to begin a pap smear, we'll insert a pelvic speculum to visualize the cervix. So here's the speculum. Next, a spatula and a brush will be inserted to the back of your vagina to the cervix to collect the cells from this area. These cells will then be sent off to a pathologist who will see if there's any abnormalities within any of them.
Next, we will demonstrate an endometrial biopsy. Here we have your uterus, which is the medical term for your womb. At the base of your uterus is a little opening called the cervix. And we have your uterus. On the inside of the uterus is a lining of cells called the endometrium. This is the same layer of cells that sheds each month during your cycle. Abnormalities in these cells can cause abnormal bleeding. During an endometrial biopsy, we'll be sampling these cells to see if there are any changes that may be cancerous or precancerous. And at the base of your cervix, we have your vagina. So during an endometrial biopsy, we'll be placing a speculum inside your vagina so that we can visualize the cervix. Once we visualize the cervix, we'll pass a thin straw inside the speculum, inside the cervix, to the uterine cavity, where we can sample cells from the endometrium. These cells will then be sent off to a pathologist so that we can examine them for any abnormalities.
Now that we have discussed the benefit of pictographs and modeled a couple of examples, we would like to encourage students to incorporate pictographs into patient education. Clinic provides students with multiple opportunities to educate patients. Although educating patients on certain advanced procedures is outside the scope of a medical student, it is appropriate for students to teach patients about simple, common procedures like a pap smear. By taking the time to draw out the procedure to the patient, you can significantly affect the patient's ability to understand important information and subsequently make an informed decision about their care, since everyone perceives information differently. As you progress through your medical training, we encourage you to develop pictographs as a tool that can help you increase your patient's understanding and health literacy.